Afternoon, everybody. Welcome to the infection control and prevention webinar that I'm going to be hosting today over the next hour. Hope you're well. Thanks for joining. Just so that you're aware, you'll get a resource pack for this session. You'll also get the slides for this session, and you'll get the opportunity to get a CPD certificate as well. And that link will be sent out next week. So that'll be sent out to the email that you registered with. So just keep your eye on the email, and you'll get links to those particular resources. So my name's Lucy. Nice to see you all. I recognise some of your names there. So we have some customers, some non-customers. So nice to see everybody. So we're just going to be looking at infection control today. Let's go on to the first slide. We're going to be covering a few different areas, but it's really a sort of a summary for staff on what good prevention and control of infection looks like within the care service. So across different care services, both domiciliary care and care home. So we're going to be looking at that now. I'm just going to turn my camera off for this, but hopefully you can still hear me okay. This is what we're going to be covering today. So we're going to be looking at, I've muted you all, by the way. So if you just stay unmuted, that helps because then there's no background noise. But if you do have any questions, just pop them in the chat because I will just look at the chat every now and again just to see if we've got any questions and answer accordingly. And then also you can ask any questions at the end too. We will be going on to the system, the care management system at the end as well, just to sort of have a look and see what infection documents we've got there. So what we're going to be covering today is quite a few different areas, but we're going to be looking at the chain of infection. So what that looks like, what a chain of infection looks like and how it spreads. We're going to then be covering standard infection prevention and control precautions that need to be taken within your service. We're going to be looking at hand washing, including alcohol rub, and also the World Health Organization, so the WHO 5 moments for hand hygiene. So when you should be doing your hand hygiene as good practice on a day-to-day basis. We're going to be looking at aseptic techniques, so different procedures that you might do within the service, how to ensure that the equipment's kept clean and that procedure is done in a clean way. We're going to be looking at outbreaks of infection within your service and isolation as a result of that. And then we're going to sort of end up looking at sharps, so the correct use of sharps, whether that's an injection or whether that's a checking someone's blood glucose with a lancet. We're going to be looking at sort of sharps, linen and laundry, decontamination of equipment within the care service, and then I'm just going to end on glucose monitoring and just have a look at the devices that are available for glucose monitoring and how we prevent infection when we do that. And then finally, we'll go on to the system and we'll look at some infection documents that we've got in place, so care plans, etc. Um, so firstly, we're just going to look at the chain of infection. So that provides an overview of the process by which a resident or a service user acquires any type of infection. So it's looking at the different chain of events that lead to someone getting an infection. Um, so we're going to look at that now. We're just going to look at how the organisms are transferred. Obviously, breaking that link is necessary to break the cycle of infection. So let's just have a look at that. The first in the chain of infection is the organism itself. So when we're talking about the organism, we mean they're a virus, a bacteria, or a fungus, a sort of a microorganism, a germ, a bacteria. Um, Common infections that we perhaps see within our care service are MRSA, so that stands for methicillin-resistant Staphylococcus aureus. That is a type of bacteria, and this particular type of bacteria is it's a different strain of that Staphylococcus aureus, which is a type of bacteria. This is a different strain. It's a bit more difficult to treat. It's resistant to certain antibiotics. There's Clostridium difficile. You may know that better as C. diff. So that's a bacteria that can cause a bowel infection and then diarrhea for that person. Um, there's such a thing as Pseudomonas aeruginosa, and Pseudomonas are a group of bacteria that are commonly found in soil or in water, and they can spread very easily from human to human. They can cause infections in the blood, in the lungs, in the urinary tract. And they can sometimes, those bacteria can sometimes be found in body parts after surgery, other parts of the body after surgery. There's norovirus, which I'm sure we've all heard of, better known as the winter vomiting disease. Um, so that's the most common cause of gastroenteritis, so sickness and vomiting. And then influenza is another common one that we sometimes see within the service, and better known as flu. So that's a viral infection that affects the nose, the throat, the lungs. So they're the types of different virus, bacteria, and fungus that we are discussing today and how they spread. That's the organism itself. The organism needs a host to sit on or a reservoir. And examples of those hosts or the reservoir, the place where the organism might sit, is on a human being, on animals, on surfaces, environmental surfaces, on day-to-day equipment, and in food and water as well. So they're the different places that microorganisms can live, germs can live. Um, if they're within the human body, they need to find a way out. And the way out of the body, so how it's spread, is in a variety of ways. So it can be through by feces or urine. If someone's got a wound, it can spread via the wound drainage. That's how it can find its way out of the body. Through blood, vomit, or sneezing, so droplets out of the body. Once the germs are out of the body, they then get spread from person to person. And the way they get spread is via people's hands. So that's why hand washing is essential. So via hands, contact with equipment, um, and they're sort of seen as droplets in the air, airborne. Which, so if someone sneezes, the droplets can be released into the air and they can be breathed in. So that's what we mean by airborne, respiratory droplets that are airborne. So there's different ways that the infection can be spread. And then, of course, it needs to find a way into the other body. This is how it gets spread. So the ways into the body, again, in a variety of ways. So if there's a break in the skin, so that could be a wound that somebody's got or a cut of some sort, or needle stick injury. But if the skin isn't intact, if there's some kind of break in the skin, then that's how infection can find its way into the body. Also via mucous membranes. So by that we mean the mouth, the eyes, the nose, and also inhalation, so breathing um, bacteria in as well. There's different people that can be more at risk. We're all at risk of catching infections or spreading infections and catching them, but people more at risk are sort of susceptible people. So perhaps people that maybe haven't been vaccinated or have certain health conditions, maybe smokers or um, a high BMI, for example, would make someone susceptible to infection, and also the elderly and the immunocompromised. So what we mean by that is those who have compromised immune systems. So they might be on a particular medication, for example, that suppresses their immune response um, necessary for their condition. But if that immune response is dampened, then naturally it's not going to be as effective at fighting infection. Um, so that's the chain of infections. I hope that makes sense to people. That chain of infection, how infection is spread from person to person. So that's why there should be standard infection prevention and control precautions within your service. Um, and your service will have a infection prevention and control policy in place. So it's important that you are aware of where this is stored or kept, and it's important that you read and understand these infection policies that you have available to you. We do have policies on our compliance centre regarding infection control as well. So if anyone did want to get any information about that, then please do let me know. Drop me an email or something, because we can show you both our compliance centre with the policies on and our care management system too. But it's important that wherever you source your policy, it's important that you do read that infection control policy just to understand your precautions that you need to put in place for the prevention and spread of infection. So if we just look at the bullet points of what standard infection prevention and control looks like, firstly, hand hygiene. We're going to be looking at a sec in how to wash your hands properly and how and when to use alcohol rub. Um, Well, the use of gloves. So when it's appropriate to use gloves, well-fitting gloves. PPE, personal protective equipment, so that should be made available to you. So gowns and aprons. There should be a process in place to ensure that there's a safe handling of sharps, so needles, blood glucose monitoring, for example. There should be procedures in place to ensure the safe handling of waste and also of soiled linen. And there should be standard cleaning of the environment as good practice on a day-to-day basis. Because it's all about minimising contact with blood and body fluids by ensuring these safe work practices, um, providing barriers to infection spread and creating a safe working environment as well. So the top one here is hand hygiene. So I just want to have a look at hand hygiene and the correct way to wash your hands. Many of you will probably know this. I'm sure there'll be posters around your service if if you're working in a residential setting. There's often posters um, t demonstrating how to wash your hands properly. Um, so this is what constitutes good hand washing technique with soap and water. And you should wash your hands when they're visibly soiled. I know we've got hand rub and we use that frequently, but if your hands are visibly soiled, you should wash them with soap and water. Hand rub is just for when they are not visibly soiled, but you need to just give them a clean. So that's really important. If your hands are visibly soiled, wash them. Otherwise, you can use hand rub.
Okay.
So hands should be washed before and after all care procedures, including the handling of food as well, especially when dealing with used linen or waste or body fluids or any contaminated equipment. You've used gloves and you've taken your gloves off. You should always be thinking about washing your hands. We're going to also look at the 5 moments of hand hygiene. So when it's really vitally important to keep your hands clean. So I'm not sure if you can see this visual here. Um, but I'll read it out to you. Obviously, you're going to get this resource pack anyway, so you will get this sent to you. But just for the sake of the webinar now, I'll just go through it. So you wet your hands with water. You apply enough soap to cover the hand surfaces, and then you rub your hands sort of palm to palm, and then you put your right palm over your left dorsum, so the back of your hand. You interlace your fingers, sort of rub there, and then the other side as well. And then you put your hands palm to palm and interlace your fingers. And then you just kind of put the backs of your fingers to the opposing palms. I'm not sure if you can see that on visual 5. And then visual 6 there is sort of rotationally rubbing your left thumb. Sort of clasping your thumb and rubbing it, and then doing the same on the other side as well. And then finally, rubbing backwards and forwards in your palms, in both of your palms, and then rinsing that soap off. Um, I'll try and show you a demo of that at the end. But hopefully that's made sense anyway. I'm sure you have got posters around your service, and as I say, you will get this um, visual. And then, of course, you dry your hands thoroughly with a single-use towel, and you're good to go. So that's hand washing when your hands are visibly soiled. What I then want to look at now is the hand sanitizer. So for visibly clean hands, but you still need to um, clean them again. But if they're not visibly soiled, you can use the sanitizer, and it's the same process. So applying enough product in a cupped hand, covering all your surfaces, and then doing exactly what we've just said there. And then, as you can see here in number 8, once your hands are dry, you're ready to go. Now, it normally takes about 30 seconds to dry, so you should allow 30 seconds. And that's World Health Organization recommendations. So the WHO recommend that this is the best practice for cleaning your hands thoroughly. So it is important that you pay attention to this process and to practice good hand hygiene. And then if we look at the next slide, it's what we call my 5 moments for hand hygiene. Um, so what that means is key moments when staff should carry out hand hygiene. So that is before touching a resident or a service user, before clean, aseptic or clean procedures. So if we do any type of procedure, it needs to be a clean procedure. After bodily fluid exposure or risk, so blood, urine, etc. After touching a resident and after touching a person's surroundings. So it's important that you're using your gel unless your hands are visibly soiled, and then of course you need to wash them, as we've said. But they're the 5 times we should be continually thinking about hand hygiene. Um, There we go. We've got a visual here, and again, remember you'll get sent this as part of the slides. It's in the resource booklet too. But so after touching a resident, before any type of procedure that needs to be clean, after exposure to body fluid, after touching a person, and after touching their surroundings. Okay, so they're the 5 moments of hand hygiene. So next, I just want to look at asepsis and aseptic technique. So what we mean by that is any procedures that are performed with that person under sterile conditions. So in a clean way, a clean technique. So in other words, we're doing procedures in a way that we're going to reduce the spread of infection as much as possible. Um, so the principles of clean techniques or asepsis, um, those principles play a vital role in preventing infection in all environments, and it is our responsibility to sort of understand these principles and what's required. So if we just go through what's required, so any exposure um, to any susceptible areas with the person's body with cuts, etc., they need to be kept to a minimum. Of course, hand hygiene, as we've just said, so correct hand decontamination should be carried out. Gloves should be used, so the correct type of gloves are used as appropriate, correct fitting as well. You don't want massive gloves that's flapping about, you want nice close fitting gloves. So clothing wise, you should be wearing protective disposable plastic aprons where appropriate, or you should have access to those. Um, any materials that you use should be sterile, so in sterile packs, for example. So if you are doing, for example, a wound dressing, all those packs should be sterile and sealed. Any sterile packs should be checked for damage or exposure to any moisture, and the expiry date should be taken into account as well. Um, and then any non-sterile pieces of equipment, so that aren't sort of put in packs, sterile packs, anything that's non-sterile needs to be kept away from sterile areas. And single-use items, if we use single-use items, they should only be used once, they should never be reused. So we'll look at single-use items when we're looking at glucose monitoring shortly. Okay, so as we know, outbreaks do happen. Outbreaks of communicable infection or an infection control incident. But what I mean by communicable infection is infection spread from person to person. So that's what communicable infection means. So there's a number of infectious diseases that may spread rapidly to other residents and therefore cause outbreaks within any care setting. The most common of these outbreaks are respiratory infections, so viral respiratory infections, and gastroenteritis, so the winter vomiting bug or norovirus. They are the sort of common ones we might see in the service. And these organisms, spread by hand contact, occasionally by other routes, like food, for example. Um, but when there's an outbreak, there's certain things that need to be done there. So the definition of an outbreak of an infection is that's defined as 2 or more related cases of the same infectious disease. So if that has happened within your service, and again, you'll have this written in your policies, your infection control policies, but you need to um, inform certain people. So that would be the manager or the owner of the service, your local health protection unit, an infection control lead if you have one, all of your staff, all of your residents and relatives too, and also the GP who can give you any advice about when to send in samples, etc. So if there is an outbreak, there should be a plan and response in place. And again, you should have this in your infection control policies. So you should inform the relevant people, as we've just said. You should seek the appropriate advice. So do specimens need to be collected, for example, microbiological specimens? You should keep good records. So it's important to start keeping a file of who has what infection, so you can collect all data. And I can show you on our system how you would mark that someone has an infection and when it's been cleared as well. There's general control measures that you should put in place. So the standard control measures that we've just been talking about now, the standard precautions, that we would put in place to reduce the spread of infection. And then also admissions and discharges to your service. It would be a consideration to stop any admissions and transfers or discharges if there has been a outbreak of communicable infection. It would be best to stop those. You always will be advised to stop those until considered safe to do so. So to admit people into your service or to discharge people from your service or transfer them to another service. So it's all about keeping people where they are as much as possible so that infection doesn't get spread. So if there is someone does have an infection and it has the potential to spread, then it may be necessary to isolate somebody, so isolate a service user. So that would be a prevention and control measure. In other words, isolating someone to prevent further cases of infection. So that should be ideally in a single room, in their bedroom, for example. So you need to sort of consider how best to achieve this, but naturally, if they've got their own bedroom, it would tend to be within that bedroom. So if we do that, if we do isolate somebody, then we need to be aware of physical and psychological well-being of that person. So the effects of isolation. So although it's important to isolate someone, it's also important to consider the effects of isolation on that resident. So you should, get the appropriate advice on that. And it's just about ensuring that, that person who is isolated uh, is still maintaining a good level of well-being. So, their needs are still being met whilst they're in isolation. It could be quite frightening being put into isolation. But it's just important to provide information to that person, verbal or written, whatever they prefer, to that resident, just to sort of explain what's going on, and to visitors too. So if you are providing verbal information or written information to the resident and the visitors, then that should include details of the infection, details and reason for the isolation, the likely duration. If you know it, you might not know. It might be when the infection is over, and we don't know when that will be, but the likely duration, and any precautions required, and along with the ways in which we're going to meet the well-being of that particular person. We can put all this in that person's care plan. So if we also look at the environment, so single rooms, as we've said, would be the best place for someone to isolate. And in those single rooms, they should contain hand hygiene facilities. So a liquid soap dispenser, hand rub, for example. Obviously, the best case scenario would be an ensuite facility with a toilet in there as well. But where possible, if it's not possible that someone has an ensuite, then at least hand hygiene facilities that they can access. And the environment needs to be as clean and clear and clutter as possible, just to sort of keep it minimalist, easy to clean, reducing the risk of spread. So that's what we do if there is an outbreak of a communicable disease and we need to isolate someone. I'm just going to check, see if we've got any chats. I don't think we have any questions. That's fine. So we're just going to look now at the sharps. There's the safe handling and disposal of sharps. Just going to make sure everyone's muted, just so there's no background noise there. That just helps a bit. Okay, so all staff should be trained in the safe handling and disposal of sharps. So when we talk about sharps, we're talking about needles, things that are sharp. We're talking about needles, so for injections. We're talking about lancets that we might use to check someone's blood sugar, to prick their finger. So that's what we're referring to when we're referring to sharps. So staff should be trained in the safe handling and disposal of sharps. And any injections, of course, need to be carried out by trained staff only, competent staff only. So the risks when we're thinking about sharps and sharps cuts, we're thinking about injuries, and they're the risks when we're using sharps, injuring ourselves, pricking our fingers, for example, therefore transmitting and exposing bloodborne viruses, so HIV, hepatitis, etc. And there's a risk of bacterial spread there if we get sharps injuries. So if you did get a sharps injury, so in other words, if you did prick your finger with a needle or a sharp, Then slide. Then it's important to bleed that. So you can see on this picture here, if you've pricked yourself with a needle, you should immediately bleed it. So put pressure on that area to squeeze out the blood as much as you can. So any sort of organisms sitting at the surface are immediately sort of squeezed out as best as possible. And then you should wash it under running water and report that immediately. It might be that you need to go to hospital or seek medical advice, but you need to report that to your senior and they will have a procedure again in place, a policy and procedure about sharps um, injuries. So bleed it, wash it, report it, pop on a waterproof dressing, and then an incident form should be done, just explaining what happened and why that incident occurred. So we want to reduce the incident of sharps injuries, and to do that, we have certain practices that we should follow when we're giving injections. So, oh, we shouldn't pass a needle from hand to hand. So if I'm just using the one hand, that's my only hand that I should be using to hold my needle when I'm injecting somebody. I'm not going to pass it from hand to hand because, of course, that's waving that needle around and it's going to put me at risk of pricking myself. You should never resheath needles. I mean, you get safety needles nowadays as well, but you still get this, like here in this picture where you've got the sheaths of the cap. So you would take that cap off to draw up to give your injection or draw up your medication, etc. But you should never put that cap back on. As you can see here, by putting that back on, he's risking his fingers here getting pricked by the needle. So you should never resheath needles. The sharp safety does begin with yourself, so it is important that you know what you need to do to minimize the risk. Um, so you should never resheath a needle, and instead you should have to hand a sharp bin. So this is what this looks like, this little image here, little sharp spin there. You get different sizes of bins and containers. So always assemble and label the containers correctly. So it will tell you here what you need to detail. So like the date it was opened, for example, it's got this slider at the top here. It's a very thick plastic and it's yellow to define clinical waste there. So they should all sharps should be disposed of correctly into a sharps container. That sharps container should be available at the point of where you're using it. So if we've gone to the person's bedside to give them injection, this should be coming with us on the trolley. It should be an appropriate size, not too huge, not too small, but the appropriate size. And then if you've gone to the next slide, it needs to be the correct container and also the correct height. So it shouldn't be too low, so you're sort of bending low to put it down or reaching up high. It needs to be at your height, at your level, your hand level, so you can give the injection swiftly, take that needle out, straight into the sharps bin. And as we said before, available at the point of use. So when it comes to sharps bins, we should never overfill them. Here we go, we've got another sharps bin here. This is a slightly different one. This is a smaller one. But the same makeup, it's got the label on it, it's clinical waste, it's yellow, it's a very tough plastic, and it's got the slider at the top. And you should never overfill a sharps bin. So it will tell you on the sharps bin, do not fill above this line. There you go, you've got your line there. So do not fill above this line. So the minute you see it's getting up to that line, or when it's reached that line, that's it. That's to be used no more. You can slide over, it sort of clicks closed, and then you dispose of that appropriately, correctly dispose of that. Again, in line with your disposal of sharps. That needs to be taken away by um, professional waste disposal people to get rid of that properly. So this is what that looks like. So never overfill it. It might be tempting when you've got a full sharps bin just to think, oh, I'll just pop one more in. But just remember that you're putting yourself at risk by doing that because you've got sharps that could be sticking out, or you're going to put a sharp in there that could stick out for the next person. So as soon as you get up to this line, click it closed, dispose of it, get a new sharps bin. So that's sharps I just wanted to look at and reducing the risk of infection there. And then we're just going to move on to laundry now. So it's a fundamental requirement of care, as we know, to provide clean linen. So the incorrect handling of it does pose a risk, infection hazard. And there's different systems in place. It might be within the person's home, you'd use their washing machine, but if you're in the care service, there we go, we've got two ladies here with their washing machine or their laundry in their laundry room. So care homes use a variety of laundry systems. So it's important to understand what system you use, why you use it, how you use it. Um, so if we're looking at used linen and laundry bags, so used linen and clothing must always be kept in laundry bags or baskets. So not, you shouldn't strip someone's bed, for example, and then chuck that on the floor. That should be going in the correct laundry bag. Um, so the handling of it, when you're handling used linen, you should be using gloves, aprons, and practicing good hand hygiene. Linen should be segregated appropriately, so it's your responsibility to handle linen correctly to make sure it's separated, so clean from used linen. Um, Clean linen should be stored separately, so it should be stored in a dry area above floor level and not stored with other used linen. So it should be very separate there. It should be kept on separate trolleys to avoid any cross contamination. So your used linen and your clean linen should be kept separate. Um, and then when it comes to washing linen, as we said, it should be the correct process using the correct facility within your care service. So the correct washing facilities in the dedicated laundry room using the correct process. So not rinsing something under the tap in the kitchen. You need to be using your correct um, laundry process for that. And then before we go into the system, I just want to look at decontamination. So the cleaning, the day-to-day cleaning of equipment and items within the care home. So when we're cleaning things, we're sort of decontaminating things of germs as best we can. And we can decontaminate using a number of methods. They fall into the following three areas. So we can keep things clean. So soap and water, we can physically remove contamination. Um, so cleaning something is what we'll do before we then disinfect something. This is like the first stage. And it's the most common form of decontamination in homes, keeping things clean with soap and water. The next step or the next type of decontamination is to disinfect surfaces or equipment or items. So disinfectant reduces the number of viable microorganisms. It's important to read the particular antiseptic or disinfectant that you use because that will tell you what it does deactivate organism wise because there's certain viruses or bacterial spores that it might not work on. So it's just important to know that and understand by reading the back of your disinfectant. So that's the second type of decontamination. So we've cleaned things, we've disinfected things, and then the third type is sterilisation. So if you're sterilising something, so that might be in an autoclave, like a high pressure steam environment where you put equipment to render an object free of microorganisms. So viruses, bacterial spores, sterilisation gets rid of those. There's different ways you can sterilise, but the common one within the care service would be an autoclave, so using high pressure steam. Um, so they're the different ways that we can decontaminate. And then the choice of how you decontaminate, whether you clean, disinfect, or sterilise, would depend on the risk of infection to that person coming into contact with that piece of equipment or medical device. Sorry, not advice, device. Um, so low risk, so things that might need to be cleaned, for example, are items that come into contact with intact skin, items that may not come into contact with the resident, or items that just need regular cleaning. So would be fine to clean those with soap and water. Intermediate risk so things that would require perhaps more sterilisation would be items that come into contact with mucous membranes, for example. Um, And then high risk would be items that are used to penetrate the skin. So needles, for example, or the mucous membrane or the vascular system, um, or anything in sterile spaces. So the preferable thing would be single-use items, so things that you can use just once, and get rid of. But if there are things that are reusable, then it's just important that we make sure we sterilise those in the proper way. So I'm just going to finish before we go on to the system. I'm going to finish on glucose monitoring. So again, we're sort of going back to sharps really here. Um, but when you do glucose monitoring, and I'm sure you'll be familiar, many of you will be familiar with these devices, these lancets. Uh, to prick your finger. There are two types. There's disposable single-use units, so throw them away after, dispose of in the sharps bin. And there's also reusable units that you may be aware of as well. We're going to look at both now. Um, so, as we know, routine diabetes care involves monitoring blood glucose levels. What you're doing is you're often taking a sample of capillary blood via a finger prick lancing device to be tested on the glucometer. So if we just look at the devices that are available, there are single-use devices, which is this one here, this lancet. So single-use device is disposable. So once that's used and you pull off this little cap, push this little lever here to prick the finger. So it's a single use, it's disposable, so that should be disposed of in the sharps bin. Even though that is, it's kind of covered, pricks in and out, so the needle isn't necessarily there poking out, but that is a sharp, that is a needle, so that needs to be disposed of in the sharps bin. It's a what use once only, so after it's been used, that's it, chuck it. So to be discarded after every use. And then there's other devices that we may also be aware of that have elements that are single use, but the unit itself perhaps is reusable. So this unit, for example, has got a firing mechanism separate from the lancet, so the sharp and the cap that goes on top of it. So you would use this unit for pricking the finger. You would pop on a lancet with a cap on it, remove the cap, prick the finger using this device, discard that sharp, and clean that unit appropriately. So using a mild detergent and disinfectant according to the manufacturer's guidelines there. We should always use gloves, follow good hand hygiene procedures, use gloves when we're blood glucose monitoring because we're exposing ourselves to blood. Wear correct gloves, well-fitting gloves. Change gloves between residents, of course. Keep your hands clean before and after use of gloves. And use the standard infection prevention control points that we've been looking at as well. So that is a little overview and summary for staff about good infection prevention and control. What I'm going to do now is just go on to the system, but I'm just going to quickly check down here that there are no questions, which there aren't. So as I said, we've got customers that are on the webinar today. We've got non-customers, people who aren't customers. All are welcome, of course. We're going to look on our care management system now. So for those that are customers, you're probably going to be familiar with these, but I shall just remind you where these different documents sit that you might find useful when it comes to infection prevention and control. And for anyone that isn't a customer of ours, if they did want us to do a little demo, that's absolutely fine. Just drop me a line. I'll give you my details at the end. I'm more than happy to give you a demo of our system. So as always, we look at care planning, and if someone has an infection, then it's important to plan properly, especially if they're being isolated. It's important to maintain that good well-being. So, we need to put a care plan in place for that person. And we do have care plans on the system for infection, which I'll show you now. And of course, as always, the care plans should be individualised and centred around that person that you're supporting. So focusing on their needs and preferences. So let's have a look at what I mean. Okay, so let's go on to Sally Webb and have a look at her infection care plan. So this is our main care plan page. So we've got a variety of care plans here, and one of which of these I've put in place. Everybody gets as standard. Use it if you need to, is an infection care plan. You could put a care plan in place to demonstrate what support you're going to put in to prevent infection. But I've put one in place here for Sally. So as always, this is our care plan template. Let's just go into the care plan now. So I've said that she's got C. diff. So as with our standard template text for the care plans, we've got what are the sort of issues, what are the goals, and how we're going to support her. So I've stated here that she's got C. diff. She's in isolation until her symptoms have improved and she's passed a formed stool. This is the goal: to be infection free, to have her privacy and dignity maintained and met at all times, and to retain a good level of well-being whilst in isolation. And then I've just documented here support that I want to put in place to ensure that she has a good level of well-being, to ensure that spread of infection is kept to a minimum. Any symptoms that she's got are treated as per recommendation and medical advice. And just the things that we're going to put in place really. Now, we do have preset text here actually. Just have a quick look at her. We had a question there. Oh, yep, Teo, you've got a question. Feel free to ask. You type it in if you want, or
Yeah, hi there.
hiya.
Yeah, just a quick an overview of this care plan. If I'm doing a care plan for somebody who is at maybe double incontinence for feces and urine, of
Yep,
course there's an infection concerns there. Yeah,
yep.
and the individual is not engaging. In the care plan, am I allowed to just say this is observation from staff? Patient is not engaging, but there's risk there because of double incontinence, and
Yes,
they're allowed
you
to do
can. Yes, yeah. You can put that, you would perhaps want to, you could put that in an infection care plan, or you might want to put that in a continence care plan, which we've got as well. So
that.
yeah, if you wanted to use a continence care plan to demonstrate what support you're going to put in place due to their double incontinence, you can use the continence care plan if you want to. Obviously, there's an infection risk there because it's bodily substances, fluids.
Okay.
Um, but yes, I mean, whether or not that person is engaging with you or not, you sort of need to detail what the support is that you're giving them
Yeah,
to
based on the observations of
you
staff
what.
observation, based on what we observe, is what we're
Yeah.
going to use to do that care plan.
Yes. So how do you mean on what you observe then? What, just give me an example of what you mean by that.
But in doing the care plan, there's some spaces where he has to ask that. I mean, was the person with you and all that kind of thing? Was
Yeah.
he saying this? I mean, he's not engaging in terms of verbal engagement. So it's just
Yes.
based on staff observation. So it's okay to
Yes.
put that there. Okay, that's fine. Thank you very
Yeah.
much.
So in other words, you're saying that that person isn't really engaging with you. So what you want to be doing is having a conversation with them and say, this is how we're going to help you reduce the risk of infection. How
Yes,
do you feel about this? What support do you? And they're not necessarily able to tell you what support they require.
yes,
Yeah, yeah.
exactly,
So
exactly.
yeah. So if that person doesn't have capacity to make a decision about that, then if capacity is in doubt to make a decision about how they want their support to be given, then you should do a capacity assessment. And if that's assessed that they don't have capacity, then of course you need to make decisions in their best interests.
Okay,
And that might be if they've got an advocate, a lasting power of attorney, it will be those people that are making
okay,
decisions for them, or you as the care service. If there is no advocate, then that's, you are then to the best of your ability, gaining
okay,
information about that person and looking at how they would best want to be supported if they're not able to engage with you for whatever reason. Does that make
okay.
sense?
Yeah, thank you very much.
Yeah,
Thank
no
you.
worries at all. No worries. Okay, so if we just go back into this infection care plan, we have got our three sections in here. I've got this text, but what we have got is obviously you get your empty text boxes where you can free text in there, but we also do have preset text that you can use, and you can tweak this preset text if you wanted to. It's in the sort of library at the back in settings. So let's just quickly go on to someone and see if there's anyone with a blank care plan, so I can show you what I mean. Let's have a look at Florence and see if she's got have a look at her infection. Okay, let's just conduct a review here because just going to show you this text we've got. Okay, so we have prompts here. You can pick multiple choice prompts and then embellish about it further down here. Or you've got this preset text. So if I click on this, we're in the needs section. Click on this and there you go. That's given me couple of statements. I might want to tweak that, add some information. So you started for 10. Obviously, we can't write your care plan. This can't write your care plans for you. Your completed ones, it's a starter for 10. It's giving you some common sense statements, best practice support. so that you can then utilise that as you need to and discuss that with the person where possible or their advocate, um, and individualise the care plan. But it's giving you some kind of common sense goals and support. So if we're looking at the support, this is all the kind of suggested support, but I would want to go through all this, make sure it's appropriate, make sure Flo's happy with it, add bits that I might need to tweak it, edit it, because this is just a starter for 10. But it is a way of getting some kind of, good sort of common sense support in there. So I just wanted to make you aware of that preset text that we have. We also have the ability to record if someone has an infection. So let's go into Annie, for example, go onto her care plan page. She hasn't got an infection at the moment. There's no alert to say she has. If she does get some infection of some kind, I want to record that because I want to put that onto the system the day that that was diagnosed and also the day that it was cleared, because that will go into my data in this care records section. So if someone does get an infection, go onto the main care plan page, go onto this observations section. These are all those charts that exist for your observations, but sitting within this section is an infection chart. So you can pick the appropriate infection, and if it's not on here or you want to add something, you can add it to your settings in the back in your reference data management section. But let's say they've got C. diff. They've got Clostridium difficile. It was today that was diagnosed. I would then say that I can put some notes in. So maybe in isolation. I can also mark it they're in isolation as well. I can put any notes in that I require and then just save that. So by doing that, I've then put onto the system that this particular person has got an infection. So then if I go to her care plan, there you go, she's got a little infection alert there. This also goes through to the devices. So the carers see this and the support workers see this. When they go onto the app, they will also see this. So when they click onto Annie, the first thing they'll see is some summary information, including the infection info. So if you tap on it, you can see she's got C. diff, diagnosed then, or confirmed then, and she's in isolation. So that's just important to have that on the system. When that has cleared, then you can go back into the infection type, go down to your table here where you've got a list of previous infections, go into your little pencil edit and say that has now cleared, the time and date, and save that. So then that little alert comes off. But that information is stored when they got an infection. And you can actually see that in your records here, in your care records audit. You can see in your analysis section. Here you go. I've got all the different infections that are in the home at the minute. If I hover over them, it doesn't give me personalised data at this stage. It's just giving me stats. So I can see who's got what at this moment in time within the home. If I go onto the stats page, I can have a look at all of these, the list of everything here. So I can look, it's that little chart that we've just looked at, but in a different format here. If I go further down, I've also got infection information here, but I might want to see how many infections were diagnosed, let's say, for the month of April. So during the month of April, how many infections were caught, for example, and recorded on the system. So if I apply that, I would then see that information. There you go. Nothing was actually recorded in the month of April. Might be in the month of May, there was 5 episodes or whatever. So you can look at sort of time frames and see how many infections were recorded on the system. So that's why it's important to fill that document in when there has been an infection and clear it off when that infection is gone. So they're all our documents that are available onto the system. You've also got incident forms, remember, as well. So if there was, let's say, for example, sharps injury, you can go onto your incident form here as well, that triangle. And any infections as well would be, obviously, you probably wouldn't be sending someone into hospital where you can help it if they've got an infection, but if they needed urgent care, they, would need to go into hospital, but that would get put onto the hospital transfer form as well, automatically, if they have an infection. So I hope that helps everyone. Let me see if there is any more questions. Nothing at the moment, but I shall hang around a bit. But as I say, if you want to message me privately after this, feel free to do so. My email is lucy@carebeans.co.uk. Lucy, lucy@carebeans.co.uk. So do feel free to drop me a line if you've got any queries, if you think of something afterwards, if you want a little demo of the site, if you want to have a look at our compliance centre and policies, then do drop me a line and I can point you in the right direction for that, or help in any way, or get the help that you might need if I can't answer the question myself. I hope that's helped. As I say, you will get your, it'll be next week now, but you will get this recorded with the slides. You're going to get a resource booklet. So that's everything that I've talked about will be in the resource booklet with those visuals as well for the 5 moments of hand hygiene and a demo of how to wash your hands, etc. And then you'll also get a link to CPD certificate. So it might be that just one of you's registered, but 2 of you have watched it. That's fine. Both of you can still get your CPD certificates. Just re-enter that information. Okay, so it doesn't look like we've got any questions. So I'm hoping that that is because it's been clear and helpful to you. I hope it has. We have another webinar at the end of the month, last Tuesday and last Thursday. This has been delayed slightly because I was on holiday last week, but this we'll have another one at the end of June. Keep your eye on the website for that if you want to register, www.carebeans.co.uk. If you want to register for that, it would be lovely to see you all. Let's have another look. Right, so we don't have any questions, so I'm going to stop sharing and bid you farewell. I'll just pop my camera back on just to say goodbye. There we go. So lovely to see everybody. Thanks for joining. Hope to see you soon. But keep your eye on our other webinars and please feel free to register, and also please feel free to contact me if you've got any questions at all about any aspect of the system, infection control,
Thank you.
whatever it may be. So it's lucy@carebeans.co.uk.